Hello, I'm Dr. Denise Milne, Executive Director of the Alberta Continuing Care Association, or ACCA. It is my pleasure to welcome you to our second podcast. Today, we are discussing preparing for respiratory illnesses for the fall and winter. We have a series of 3 podcasts dedicated to this very important topic. Before we begin, I'd like to thank Moderna for their generous contribution in sponsoring this episode. We are so fortunate to have Michelle Charlesworth, Senior Operating Officer of Covenant Care and Covenant Living, and one of ACCA Board of Directors, join us today. Michelle brings a wealth of experience to her role with over 25 years of professional nursing practice and administrative experience in acute and community care settings. Her diverse career has seen her work in rural and urban settings in the Northwest Territories, Nunavut, and Alberta. Most notably, she has held leadership roles in supportive living and long-term care and was employed with Alberta Health Services before joining Covenant Care and Covenant Living in 2019. Her mission-driven leadership is underpinned by a passion for providing safe, reliable, and quality care. Michelle, thank you so much for joining me today at this podcast. Much appreciated. So today we're going to talk about preparing for respiratory illnesses in the fall and winter. And Michelle, can you share with me your experience with respiratory illnesses? I mean, you're a nurse by background, but also a healthcare administrator.
Yeah, and good afternoon. Thanks, Denise. A pleasure to be here. So as you mentioned, I am a nurse, and I think in all of my years of nursing and in different backgrounds, there's a couple of things that really stand out to me as importance, and that regardless of the setting, is the importance of immunization and herd immunity in our fight against respiratory illnesses. I say respiratory illnesses are not just a clinical challenge, but it's really a commitment to us and all of the partners in the system of how are we protecting the most vulnerable.
Great. And so in terms of the continuing care sector, which you're heavily involved with and you have a senior leadership position in, and as well sit on the ACCA board, what are your thoughts about how we can best support operators, whether they're in home care community or in facility-based services, in preparing for what's going to happen come fall, winter, and taking care of what, as you said, the most vulnerable in our sector? What are the things people need to think about doing, and how is that aligned maybe with, Alberta Health and their policies?
Yeah. Well, there's a lot of things that come to my mind. So I think the first is really that communication, coordination, and collaboration. It is all of the partners. So even just from a systems level, the role of our IP&C leads from AHS, our community pharmacies, the provincial teams that support the immunization programs, and then, of course, our type A or B, supportive living and long-term care, and then our non-designated in home care. I think it's really that, going back to that communication, coordination, and collaboration of planning. And so I think over the years, I've really seen the role of our pharmacies taking even a bigger role and transition. And it has led to success of clinics. And so I would say from my experience, and even in my homes, we know that in the summer, we're already planning ahead for our fall immunization clinics. And so the pharmacists have been key to that success. I know we work with CareRx and Covenant Pharmacy, and it is where they have their checklist, and it's the partnership with the site team that really sets that up. And then, of course, that oversight from the provincial teams to make sure that we are having our consent forms done, the communication done, and then all of the details of the clinic. But I think, again, then it goes back to that communication of when are the clinics going to be held. And I always know that every year we know it's coming and we know it's October, but even this week, no one has dates. So it's like everything's always done at the last minute, even though we're prepared, because we're waiting to really find out when is the vaccine going to be when will the pharmacy have the vaccine, and then, of course, of setting the dates and all of that.
So, Michelle, can you speak to the types of vaccinations that are happening for our most vulnerable, and actually the increased scope of pharmacists in our system has changed substantially, right? And we rely heavily, I mean, everybody knows they're community pharmacists, ideally,
Yeah.
but their whole scope of practice has changed. And how has that impacted in service delivery in terms of respiratory illnesses?
So I could say from one of the things that, just even going back to the home care question, I know community pharmacists across Alberta are instrumental of working with retirement homes or different facility-based, or even if they're not facility-based, type B, A and B, to set up the immunization clinics. And that typically is our annual influenza immunization, our COVID-19, also offering, depending on the eligibility, if they're due for their pneumococcal. And then on top of that, this year is the RSV. So that's new. So that, again, the timing and all of that, it's a lot for immunization program, and really looking at that we're protecting the most vulnerable and those that are at risk.
So when I was reading the Alberta Health Outreach Immunization Guidelines, they talk about like 3 visits.
Yep.
Can you speak a little bit about that? Like, how does that happen? Because you're right, if we don't have timelines on the release of the vaccinations, right, as people have planned and they're waiting to, let's put this clinic together because we have the supplies so that we can ensure individuals get the vaccinations as needed, right? Then what happens?
Yeah.
Yeah.
So, first of all, great questions. I would want to even say, in the province and in the sector and all of the stakeholders and even all of the roles and responsibilities, have they all seen the document?
Yeah.
And so I would even question that. I would say that all the aspects are being done, but even looking at the visits, I think it's new. The document, I know, only came out in June, but even talking to stakeholders in our industry, not everybody has seen the document.
Okay.
So I think typically in previous years, all of our homes, they planned the mass immunization clinics.
Right.
And so that's typically when the COVID and influenza can be administered together, and also looking at who's due for the pneumococcal. RSV has to be given 2 weeks later.
Oh, okay.
So some of the feedback that I've gotten, now that they're looking at the timelines and what's in that document, how is this going to work with timing? And even some of the plans that have been, homes that have put in with their schedules and their pharmacists, they're going back to the board to say, okay. So it has posed a challenge, although yes, I agree with the principle that we don't want to just go in and do one clinic. We want to make sure that, and the earlier we do it in the season, the better. But I think it is going to put some challenges for that logistics planning perspective.
So ideally, some operators, whether they're home care going into community or facility base, they're going to be operating 2-3 clinics, hopefully with the same individuals that came to the first clinic, second clinic, third clinic, because there's follow-up within that, right? And then there's timelines regarding
that are mandated from immunization dates that you can't just change.
Yeah. So that is hugely busy.
It is hugely busy. And when we already know that our human resources in all across the sector is impacted, it is posing a challenge. I know some teams that I've talked to, they're confident that they'll be able to do it. Other teams are like, wow, we would have loved to have been at least part of the earlier discussions or had some input into it of the timelines from that perspective.
And is there a timeline to the end date of the vaccinations?
Typically, no, there's no end date. From my experience within continuing care, We know that when it's released, it's the priority, of course, because typically our seniors and those with chronic health conditions are prioritized. So we really want to focus that at the beginning of October and whenever those dates are released. But I know even in my homes, what we'll typically do as new people move in or there's changes, we'll keep a list of those who would agree and consent to their immunizations, and then we'll do follow-up. And so we do that throughout the season of making sure that immunizations are offered to residents, and then as well as for staff. So I know that many of the homes and different clinics that are done, it's not just for residents and volunteers, but also for the staff to come in and have their immunization.
And so what's been the uptake for staff knowing these clinics are going to happen? They can potentially do it on site, get their vaccinations. How has the uptake, like in terms of conversations around that? What's that been looking like?
You know, I would say overall there is hesitation from staff to get immunized. And the data that I would see of staff immunization rates pre-pandemic to where we are today, a marked difference. Staff do not want to get immunized. And when I say why, like what's the difference? Overall, just exhaustion. They've had too many immunizations, just don't want to. Some of the data that I've seen across Canada is just even the belief of people, even though the influenza immunization is, it's, you know, there's still a belief that they can get influenza from the vaccine. So I think there's still a lot of misconceptions and myths out there. But overall, there is just what I'm hearing, it could be a cultural reason. They just don't want to. It's my choice. And some staffers say, if I need to, I'll take Tamiflu if there's an influenza illness like outbreak. So it really is something that I think across within the province. And when we're really looking at our working together and our fight against respiratory illnesses, and we know the critical importance that immunization and herd immunity does, it's a worry. It's real. I would say in regards to residents and the goal of 80% in the program, I'm not hearing that that's an issue, even at the homes. Residents are agreeing and typically can still, in agreement. So the real difference that we're seeing is in the staff.
So any thoughts on how to shift that, shape it differently from your experience?
Well, again, another great question. And I think that's something that my teams, we've been exploring. You know, in the past, we've all done kind of like incentives or a weekend away, you get entered in a draw or some kind of celebration. Those don't seem to have an impact anymore. I think we really need to go back to co-create with our staff and look at all of us and the partners in the education, the understanding, and then really what is the true barrier to our staff? And then instead of doing how are we working with them to co-create that? And we need a whole campaign on really respiratory illnesses and looking at, and how can we use the data for that?
Yeah, I think that's a great idea. The whole co-creation, co-design, but the involvement of the staff at the front end, because it's like, cleaning the slate, let's start over. We've got this hesitancy. Let's figure out what the root cause is. But one way of doing that is let's go back to the, understanding and educating people. Why? Because you're dealing with really vulnerable people.
Yeah.
Right? And so we all have a responsibility. And so how can we all, as you said, collaboratively work this out?
Yeah.
Respecting people might have cultural issues, religious issues. I get all that, and that's really important. But how do we sort of come to an understanding?
Absolutely. Yeah. And even from the resident perspective, how does the resident feel as the majority of residents in continuing care? I'm hearing 80% is not a problem to reach that goal. How do they feel if they have a caregiver or someone providing services for them that isn't immunized? So again, that whole looking at all of the aspects, and those are questions that residents and families asked. Is my loved one or the staff that are caring for my loved one, are they immunized?
Yeah, and from a caregiver's perspective, that would be a huge issue, right? Because they want their mom, dad, or whoever to be safe, have the quality care, and to live a quality life.
Yeah.
Yeah, okay. The other piece I wanted to talk about was how the scope of pharmacists have changed, right?
Yeah.
And so in your homes, do you have your nurses provide and give the vaccinations, or do you rely on like community pharmacists?
Yeah. So historically for supportive living, have not had staff trained. In long-term care, staff trained. But right now, and actually for the last, I don't even know how many years, I don't train any of my staff in immunizations. We work with both of our pharmacists of providing the immunization clinics. So that really has helped with not an impact of needing to train and educate the nurses, but they'll take their role of organizing the clinics, the tracking, the consents, and all of that. So really that active partnerships of setting up the clinics at the homes is key. And without the pharmacist, it would be a challenge from a staffing perspective. So our clinical pharmacists that have the competencies and do that make a huge difference in the success of that. And it also is a lot to recognize on the pharmacist, because there is so many different, having an immunization clinic isn't just simple. It's not a simple thing. It's going from making sure that we've had the professionals assess of what is the immunization history, the tracking, the documentation of it, making sure that we have the cold chain protected, making sure that, especially in our remote areas of Alberta, is there vaccine fridge. You want to make sure that we're keeping the integrity of the vaccine. And then, of course, it's all of the follow-up and all of those things afterwards. So I just want to say a big shout out to all the pharmacists, because I know there's many pharmacists across the province that really are the driver of the success of the immunization clinics.
Great. That's wonderful, actually. I mean, pharmacists, the whole scope has changed tremendously, and I think it's really been so valuable in our healthcare system.
Actually, I was reading overall just in Canada, I think it was 23, 52% of adults that for their immunization, especially influenza, received it from a pharmacist. So that really does show that shift and that change, not just in our continuing care sector, but just in our general population across Canada.
Great. That's wonderful. Michelle, can you speak to sort of the importance of those protective, preventative safeguards that align nicely with the immunization program?
Yeah, I think in addition to the immunization program, as you mentioned, we need proactive, pre-planned measures in place. So we all know the first thing is hand hygiene. Yeah. It doesn't matter where the setting is. We all need to be teaching our young ones, all of us, of the proper hand hygiene. That is our first line of defense in respiratory illnesses. Then it's also as when staff are not well and they have symptoms, are we supporting staff to not be coming to work and that spread? As well as the monitoring of residents. So do residents know what symptoms themselves to monitor and when to seek some medical attention? Or in our facility-based home, the staff of that proactive, when there is a change of respiratory illnesses, we know that whole outbreak management is from early onset of detection, the monitoring of the symptoms, the right isolation, And with that, of stopping the spread is the importance of PPE. So the protective, personal protective equipment. So making sure that staff are donning and doffing the PPE properly, that they have access to it. All of those, the education. And then we know, as we've seen in the pandemic too, we're busy, we want to cut corners and we take shortcuts. So how are we, instead of waiting till an outbreak is out of control, how are we doing our hand hygiene audits? Are we monitoring our hand hygiene results on a monthly basis and sharing that with staff and families, as well as doing on-the-spot education and proactive audits to really build in that systematic quality improvement aspect for ensuring that there's safe infection prevention control measures?
That's excellent. Thank you. I think that how you explained that was beautifully clear, right? These are the steps we all need to take. It's ongoing education of everyone, caregivers, the resident or client, and our staff, right? We all need to contribute, be part of the team to keep the environment safe.
And we have, as a province, we have a standard outbreak manual. No one needs to go look what to do. As I mentioned earlier, we can disseminate and do further of that, the immunization program document that you mentioned. But really, in addition to that, the outbreak manual's there. The resources are there. I know I hear from my teams of the importance of the AHS IPC leads in the zones. They'll come and offer proactive education.
Excellent.
I know many of our physicians work with the teams to answer if staff have questions. Is it safe for me to get immunized? So really the whole care team comes together in that proactive, preventative measures.
Yep. Great.
We have resources in place. That's not a problem. But it's thinking outside of the box of how do we take the knowledge that we have and the data to actually have a shift of even being more proactive in our fight against respiratory illnesses. And how do we impact that so that, because there's such an impact to quality of life for residents too. Like when residents are in isolation in their rooms, like I'm just trying to think if there's more about quality of life for our residents and that balance, right?
Yeah, and so just taking that a bit further is the fact that when a resident is isolated, now we're going into other issues around their own anxiety, their depression, loneliness, right? Because they need to be safeguarded and others need to be safeguarded from them, right? And so it's got this spill-off effect. So, the goal is let's lessen as much as we can respiratory illnesses because it's impacting the quality of life, which means then it's impacting, their involvement with their family and individuals coming to visit, and then it's impacting staff, right? But the well-being of the resident, is challenged because they're trying to recoup from what they're struggling with, but it's taking some time. So overall, their quality of life gets sort of paused, right, as they try to heal from this one of the respiratory illnesses.
Yeah, and I think that's a really good point, Denise, because what we've seen, especially during the pandemic, the quality of life and everybody's mental health was so negatively impacted. And I think we have seen changes in our outbreak management and our protocols of timelines of finding that balance of where's the isolation time, when could a resident come out in, communal space and even have a mask and all of that. So I think we've seen some shifts of, say, maybe in the heat of the COVID-19, but it's finding that balance of supporting the quality of life for residents when they can't engage in group or social activities or they're in isolation, to also not having the spread. And that's delicate. That's difficult.
And the other challenge that comes along is their medication regime is impacted because they're not well. And then, they're on a set of, let's say, some medication that may have an impact as well because they're on other medication trying to, work through that respiratory illness or illnesses. And so everything has to be reassessed constantly for that individual.
Absolutely.
Yeah. So, I mean, it's the interaction between that person's well-being and their mental health, their physical health, and let alone with their family and then staff. And then, like, it's just the stuff we've talked about today is really proactive, and there are resources out there. So we have that nailed down. It's about, let's make sure we're implementing safely those the resources that we've been given to make sure we can lessen where possible and prepare for when people have a respiratory illness.
Yeah. Someone had said to me, as we go back to school in the fall, and it's almost like all of us in the sector need to have respiratory illness. Someone said school every fall, right? As we prepare for our immunization clinics, just build that in as a reminder that we're reviewing the education, the right practices, and that we're hearing what the barriers or what questions residents may have, their families or our staff, and it's just a good refresher. And is there something that we can do that every fall everybody can really have that at the forefront to make sure that everything is in place, like you said, from that proactive measure.
Well, and I think you coming into this podcast is part of that going back to school feeling. Everybody, we all have pieces we all need to take care of. And here's an opportunity just to do some checks and balances about the things that we need to do, whether we're a staff in long-term care or we're a home care nurse or aide, or, we're working in an office building, right? Or we're working in a school. We all have our own things that we need to take care of so we don't, we don't impact others in a way that they become ill, right? Because we know our most vulnerable will struggle deeply with trying to recoup. It's so much harder because maybe they have compromised health, and it just makes it more challenging.
Absolutely. And as we've seen even with COVID-19, those are even at higher risk of death than, say, our population that isn't fighting against some chronic or immunocompromised or things like that. I almost think that, one of the things is we talked about the immunization Alberta-wide outreach program document and all of the roles and responsibilities. And I think when I talked to the partners and all the roles, even if they hadn't maybe seen the document, everybody's really on board with that. But I think everybody wants to be part of the journey. And what a great time to evaluate that after this season. What worked, what didn't work, and how can we do some really provincial-wide campaigns? So where we are seeing some gaps, and we know one of them is staff immunization rates, really how can we do some targeted work together with our stakeholders? Like you said, we were talking about earlier of co-creating that and really making a difference. And we're going to have to do a shift and do some disruption and not keep doing what we're doing to address some of those areas. And I think it's going to take a targeted, and instead of each home trying to do their own thing, how can we really elevate that platform to really look at a provincial-wide campaign?
Yeah, I think those are excellent points, and we need to encourage our partners at Alberta Health to take this on in partnership with Alberta Health Services, the continuing care sector. I think that's
our pharmacies.
Our pharmacies,
all of our pharmacies.
Absolutely. AMA, all our partners. We have multiple partners in our systems, and we all need to sort of be going kind of in the same direction to best support Albertans.
Absolutely, Denise, agreed.
Okay. Certainly we can see a role for ACCA in that. I think it's very exciting, and I'm really thrilled that you joined me on this podcast. This has been fantastic.
Yeah, it's been fun. Thanks, Denise.
Thanks, Michelle.